Hi everyone, this is Duhita Vijayaratne from UNDP in New York. This is the fourth COVID Coffee Chat addressing UNDP COVID-19's interventions in Nigeria. And I'm delighted to be here with the resident representative of UNDP Nigeria, Mohammed Yahya. Welcome, Mohammed.
Thank you.
Thanks for being here. So Mo, we could see the number of confirmed cases in Nigeria are rising, and it is becoming one of the most affected countries in sub-Saharan Africa. In relation to this, could you just briefly describe the key role of UNDP as the integrator of the UN system and supporting the government priorities in implementing the multi-sectoral response plan?
Great, thank you, and thank you for inviting me. Once the crisis started, UNDP was lucky because we had already built capacities across the board, specifically capacity related to data analysis, data visualization. I'll come back to that. So we approached the resident coordinator and had an engagement with him and said, look, as the crisis is starting, it's really a good idea to start having one UN offer. This is what the UN family can do. The government had just released its multi-sectoral plan on what it wants to do in the health sector. So we wanted the UN to put together a document that says, this is our support to you. And then the resident coordinator was happy for UNDP to take the lead. So UNDP put together the UN offer, one UN offer on COVID. The interesting part of the one UN offer in COVID was there was a health component, but also because we're UNDP and we already obviously started thinking about the impact this will have on livelihood and poor communities, we had already integrated the immediate socioeconomic responses such as cash for work, cash transfer and conditional cash transfers for the most vulnerable, especially in urban areas, and other socioeconomic needs. So the document was drafted actually in 2 days by UNDP and then shared with the UNCT, who then adopted it as the UN response plan. But in it, we also built in a basket fund idea that UNDP will manage, because to achieve this, we need a basket fund. And obviously, we propose UNDP to be managing the basket fund. The interesting part of that was that we've already built a political capital with the UNCT. We were the first one to come up with the idea of a one UN response plan. We gave leadership role for the WHO, who's the lead on the health side, but also recognized early on the need to start looking at the socioeconomic dimension, so that there was no contest or pushback from the UNCT for UNDP to be essentially the integrator. And that for me was an integrator opportunity, bringing different parts of the house, looking at health, but also beyond health, and offering something that was more comprehensive that the government was happy to receive. And started already thinking about the financing. How do we finance all these needs? So that's the way we started. And then we went out with the RC. This is really important to resource mobilize. And immediately we were able to secure a significant injection from the European Union of up to 50 million euros into the basket fund. And now the basket fund is about $62 million. And we expect it to go up with private sector, a lot of private sector coming on board, such as Maersk and Dangote Foundation and others, Gates Foundation also coming on board. So the interesting part, to answer your question more directly, is that the UNDP played an integrated role conceptually. UNDP was the first one to think through the idea of, yes, it's a health crisis, but it's also social and political crisis, and we need to start putting together a comprehensive response. UNDP obviously is not a health organization, but we are the only agency that has a comprehensive overview of the challenges of the pandemic, the social implication, the political implication, and also understanding the relationship between health and development. And we were able to package it in a way that it became very helpful for government and our partners. And the data part has become extremely critical, because we were able to really use UNDP data capabilities and work with other UN agencies such as UNAIDS and others to bring the health component. And it's UNDP now that has built a dashboard on trends, on where the disease is going and what are the implications for the response.
Okay, thank you, Mohammed, for that great overview reflecting on the One UN offer and UNDP's engagement in leading in that, and also the data which has informed very much the socioeconomic impact assessments, as well as in tailoring the response, addressing both the health component, as you say, and the more comprehensive package. One of the areas that I know your office is working on is the communication. And as we all know, social media is what informs our news nowadays to a large extent. I was wondering, how has UNDP Nigeria leveraged these communication channels to disseminate preventive messaging, as well as mitigate the misinformation that is being communicated, and also reaching the wider population in the country?
Yeah. Just to say, we were very, yesterday when I was talking to my colleagues in RRs, one of the things I said is that we were lucky because we had built a team and capabilities that met the challenge, was able to respond to the needs. And the communication part is one of those areas. Just before the pandemic had started, we had gone to Lagos and engaged a lot of people who are big on the social media, but also work in the movie industry. The Nollywood is very big here. A lot of stars in the music industry. So we had already started that engagement. So it wasn't a big jump in utilizing those networks to start engaging on the pandemic. Now, to answer your question on a COVID aspect of it, as you know, in this country, like anywhere else, there's a lot of fake news online. Plus, there's not a lot of trust in what government says. There's a crisis of governance is a problem in many developing countries. Nigeria is no different. So you need voices that are trusted, that are seen as more neutral, to be able to say, to be able to engage the public on what the prevention agenda is. How do you, what are the basics you do? Why staying at home when the government asks for lockdown is an important part of winning the war against the virus. So this has been extremely helpful. We've been using social media, but just to add, we actually reach much more people through radio, because this country, a lot of people listen to radio, and reach them through their own language. Here, Pidgin English is a big language that is a more unifying language, but also we use a lot of dialects and across the country to engage. And it's been very successful. And I think by end of this month, we should reach 60 million. I understand by now we're around 40 million people we have reached.
Okay, great. That's excellent work. And it's interesting how you're already using an existing platform that was created by the country office to spread the word. And as you referred to, using trusted voices for the population in terms of the music artists and celebrities, and also the utilization of radio, which makes the messaging very accessible to everyone. In regards to the wider population, and knowing that given the context, the economy is very much driven by the informal sector. I was wondering, what do you see are the main challenges in Nigeria in relation to implementing non-pharmaceutical interventions in the country in comparison to elsewhere?
One of the things that concerned us about how you do non-pharmaceutical intervention, which is actually essentially from the Imperial College paper that has informed the entire world on the idea of lockdowns and shutdowns. We thought early on that this would be very problematic in countries such as Nigeria, where most people live on daily wage as a survival. You can't lock people down when the alternatives, or the capacity of the state to cushion against that does not exist. Nigeria had many problems at the same time that the COVID brought. One was that the oil prices collapsed, so the government's resources were nearly depleted. So its ability to respond is very limited. Second, you have a global recession that the pandemic brought, that Nigeria is affected by. And the third is the disease control mechanisms that have been put in place are exacerbating poverty and hunger. I mean, I give you an example. In the northeastern Nigeria, where we had the Boko Haram insurgency, we expect food insecurity to go up by more than 90%. We have seen in 2 weeks of shutdowns in this country, about 3.8 million people losing their jobs. So the non-pharmaceutical interventions were never going to be extremely practical in the long run, because people always forget the entire concept of the non-pharmaceutical approach is to give the healthcare system an opportunity to cope. But if you don't have a healthcare system, there's nothing to cope. So there's no curve to flatten. So it made very little sense in having this tough non-pharmaceutical approaches in a country where the healthcare system doesn't exist. But that doesn't mean we don't do social distancing. So people always confuse shutdowns with social distancing. You do social distancing, you wash your hands, you keep away from people. But the concept of the shutdown is what has been very problematic. So what UNDP in Nigeria did was to put together a very interesting paper, and we understood very well that we are not a health organization. So we partnered with CDC, the American CDC. We partnered with the EU health experts, the European Union. We partnered with the WHO. We got all of them together with UNDP holding the pen and us coming through the economic impact part of non-pharmaceutical interventions and what that looks like. So we're able to put the data down. So this is what we submitted to government that actually influenced the government's current policy, which is it's not opening up back to what it used to be, but it's some of a gradual opening up with some controls such as curfew, like schools are not opening, football games are not being played, but people should be able to go out and work, and masks have become compulsory. So there's a middle ground, and I think UNDP was able to contribute to that middle ground.
Okay, Mo, that's very interesting, and how also that analysis has informed the government policy and programming. As you say, it's very important to tailor the interventions according to the context, and also for listening to the main key challenges which is seen in Nigeria, which might not be the similar in other countries in the world. So Mo, my coffee's up, and I think this concludes the coffee chat. It's been very informative, and I'm very sure that your answers will inform and be very useful for other country officers and the colleagues who face similar types of engagement. So thank you again for participating, and I want to wish everyone out there a good day wherever you are in the world. Thank you, Mo.
Thank you, guys. Thank you very much.